Hi there, I'm Dr. Kathleen Schubert, and I'm going to talk with you a little bit today about my Lyme's disease test. So, when we think about New Zealand, we don't necessarily think about Lyme's, do we? Because it seems to be something that is more prevalent in North America, but interestingly, that is spreading into New Zealand and Australia, and this is a tick-borne disease that often starts out with just flu-like symptoms. So some people don't even know they actually have Lyme's disease, but it can actually in later stages turn into really chronic bodily issues, like you can have organ issues, you can have body aches everywhere, chronic fatigue, and some of the symptoms of this could be sensitivity to light, ringing in one or both of your ears, diarrhea, constipation, unexplained hair loss, headaches, twitching, spasms in the muscle, persistent sore throat that won't go away, swelling around your eyes, all these things that people might think are maybe just allergies, or maybe they just have a cold. But if you are experiencing persistent fatigue that just doesn't seem to go away, Lyme's also, it doesn't necessarily have to come from the tick bite itself. It is transmitted. What we are finding recently is that it can be sexually transmitted, and with other bodily fluids as well. So it is quite contagious, and Lyme's is quite prevalent now in Australia, and therefore with all the traveling to and fro, you get a lot of cross-pollination and Lyme's coming into New Zealand. So with a simple one-off blood draw, this can test for several strains of this Borrelia bacteria that comes from the tick. And there are natural protocols that are wonderful kind of complementary therapies. Even if you've already been treated with antibiotics for Lyme's, these are very good for cleansing the system and supporting the immune system. So I'm happy to work with you. If this is an issue for you, or if you suspect it, feel free to visit my website, www.drkathleen.co.nz. Look at the test kits there, and you can see the kit there and take it for a blood draw to your local lab, and then I'll receive the results in a few weeks. So I'll look forward to working with you, and feel free to learn more, view a sample report on my website. Thank you.